There are a number of ways in which migration and health are interrelated. The migration of an individual can not only have health effects on those who stay behind, but it can also have effects on the person who has immigrated to another country. In this explainer video, we'll be looking at the effects of migration on healthcare access and outcomes for migrants in countries of destination. But before we get into that, we need to first be clear about what we mean by migration. Migration is the movement of a person from one place to another for the purpose of residing in that new place. Migration can be of shorter distances or longer distances and periods of time. It can be within a country, which is called internal migration, or it can be across country borders, which is called international migration. In this video, we will specifically look at healthcare access and health outcomes of immigrants in host countries. Access to healthcare means having the timely use of personal health services to achieve the best health outcomes. This basically means being able to have medical care or medication when needed. According to the WHO, a health outcome is a change in the health status of an individual, group, or population which is attributed to a planned intervention or series of interventions, regardless of whether such an intervention was intended to change health status. So the example of an intervention here would be migration. Examples of health outcomes for migrants in destinations might be lower rates of hypertension and diabetes compared to locals, or fewer hospitalizations. Of course, it's important to mention that healthcare access has an effect on health outcomes, since a lack of access can lead to small health problems becoming large health problems. The health of immigrants in the country of destination is one of the most studied areas of health and migration. This refers to both healthcare access and health outcomes of immigrant populations, often compared to native populations. When studying the effects of migration on health outcomes in countries of destination, scholars look at both communicable and non-communicable diseases. A communicable disease is an infectious disease transmissible from person to person by direct contact with an affected individual or individuals' discharges by direct or indirect means. So, examples of communicable diseases are tuberculosis, HIV/AIDS, influenza, and Ebola. A non-communicable disease is a disease that is not transmissible directly from one person to another. These diseases are often chronic in nature, tending to be of longer duration. So, examples of non-communicable diseases are autoimmune diseases, strokes, most heart diseases, diabetes, and most cancers. While we do see a higher prevalence of communicable diseases among some immigrant groups, much of the more recent research has focused on non-communicable diseases, particularly in developed country contexts. Non-communicable diseases have gained importance given the diet and lifestyle changes that have been observed by many immigrants in Western countries. Changes in dietary patterns in the context of the destination country occur mainly due to new food environments, new socioeconomic status, as well as changes in physical activity level and new work and living environments. Particular health outcomes associated with migration include a higher prevalence of non-communicable diseases triggered by changes in dietary patterns, including obesity, type 2 diabetes, cardiovascular disease, and some types of cancer. Common changes in dietary patterns usually include the use of foods high in calories, saturated fat, and simple sugars, including fast food, processed sodas, and to a lesser extent, artificial juices, as well as a decrease in dietary fiber, fruits, and vegetables. Immigrants may be more prone to stress and depression because of their legal status, socioeconomic situation, and separation from loved ones. Mental health and well-being factors such as stress and depression may also impact dietary and lifestyle changes that lead to poorer physical health outcomes. Migrants are also prone to working in jobs that have more health risks, including construction and agriculture. In some jobs, immigrants are exposed to dangerous chemicals, risks of accidents, and are more affected by the weather as many jobs are outdoors. Immigrants are known to be more highly represented in what are called 3D jobs. Those are dirty, dangerous, and demeaning, which does not only affect their physical health, but can also affect their mental health. When looking at health outcomes of immigrants in destination countries, a phenomenon referred to as the healthy migrant effect has been observed. This refers to the fact that on many measures, first-generation migrants are often healthier than natives in the country of destination, but this effect seems to diminish as migrants increase their duration of stay in the destination country, and it is usually not present in the second generation. For more on the healthy migrant effect, you can check out my video linked in the description below. Health outcomes of migrants in the destination country are highly affected by the migrants' capacity not only to access healthcare, but also their behavior in relation to seeking both preventative and curative care. Their access to healthcare depends greatly on the country they've migrated to and the public or private healthcare provision offered to the migrant populations, as well as their legal and socioeconomic status. Barriers for migrants in general include financial and administrative barriers, different health profiles and awareness of chronic disease amongst migrants, migrants' awareness of the organization of health systems and entitlements in the host countries, and language and communication. In developing countries, physical accessibility is a particularly pressing problem for refugees. A common problem is a lack of capacity or overcrowded or overstretched resources, particularly following an increase in refugee flows. Some studies over the years have found an overuse of emergency rooms and underutilization of preventative care among immigrants. This is usually found among populations that have a more difficult time accessing preventative care and early care due to lack of entitlements or difficulty understanding and navigating healthcare systems. Besides the other barriers already mentioned, discrimination and xenophobic attitudes from health professionals and providers further discourage migrants from use of health services. Differing ideas about how to best respond to health issues across cultures is another barrier to migrants seeking treatment, as they sometimes opt out of formal health care and seek informal treatment instead. At the same time, approaches to dealing with diverse populations from different immigrant backgrounds are lacking in many health systems, such as the provision of free or inexpensive language services and community-based cultural support staff, culturally informed care delivery, and culturally tailored health promotion, disease prevention, and treatment. All of these factors can impact the access of immigrants to healthcare. While there is much more that can be discussed here, I hope this video gave you some more insight into some of the basic understandings of the effects of migration on immigrant health outcomes and healthcare access in countries of destination. If you're interested in the effects of migration on the health of those who stay behind in countries of origin, be sure to check out my video linked in the description below. Please be sure to leave your questions in the comments and give this video a thumbs up if you found it helpful. If you're new here, don't forget to subscribe to the channel and hit that notification bell so you don't miss any of my videos that are uploaded on a weekly basis. And I do hope to see you next time.